So the healthcare industry, in terms of doctors and healthcare professionals, have been working for a long time to try to get us to not come to the hospital. Stay out of the hospital, that's what we want. And then just recently with COVID and the pandemic, the way that it's going, we're realizing we don't have enough beds if things get really, really bad. It's a real difficult challenge for people that are trying to actually make sure that we're healthy and safe as we move into some unknown territory. So we see a big shift in thought process associated with facility development. The planning process is stalled, and how to actually deliver more buildings over time of what type. Those are the questions that have been asked, and there's really kind of this hesitancy about that much investment because we don't know exactly how we want to invest. I think what happens is that we figure out how to use existing buildings. There's so many existing buildings that are out there that are just kind of being unused, and it's either because nobody recognizes the opportunity that's there, or they think the challenge to actually bringing them into code compliance is too much. So you have existing buildings that are old and decrepit and maybe they don't want them or whatever else it is to think of those things as just a box. It's just four sides to the box and then some lid. And then to figure out how to actually make them work for what you're trying to deliver. But there's ways to think outside the box there too. Tough part is floor to floor heights. They need to be different because we have, all of the mechanical needs that we do. Build something to the side of it and attach it and have things come in from the sides. Basically create a whole new facade around it. We can be creative. So if we can get the healthcare industry to identify that existing buildings are worth spending some money on, put in a little investment, I think it's definitely worth it.